Dr. Gomez, lots of people, be it adults or be it children, these days want orthodontics, need braces. They can do lots of things. They can, instead of cosmetic dentistry, adults sometimes can go into braces. In any case, in your office, are you doing orthodontic work, and what type of orthodontic work are you doing?
Yes, we are. We do every single aspect of orthodontic. We can do Invisalign or regular ortho.
Okay.
And we see a lot of kids in the office, so we do a lot of cases, and also adults are getting now ortho more than before, because patients used to think that ortho is not for adults, it's just for kids. But now we're seeing people with cosmetic dentistry, they more aware of what can be done. Sometimes you don't really have to go for veneer if you can fix the teeth with ortho.
So basically you don't have to go and grind down the veneer and slap on one of those faked tooth nail, I guess. So that's less damaging the teeth and on an average probably less expensive also, right?
Yes, it is less expensive than going for a full case of veneer, but I'm not trying to say that veneer is not good. It's just like it's a different aspect of fixing whatever the patient's desire is. Sometimes patient just wants a minor little thing to be fixed, and that could be done with ortho, or maybe the case is not for veneer, it needs ortho. So it's a combination sometimes to one to the other.
Right.
But also,
it's another option. It's another option, and it needs to be explored. And different patients with different situations in their mouth might qualify for one or the other, or for a combination of it.
Exactly. Sometimes the patients has occlusion problems, TMJ problem that cannot be fixed with veneers. They have to be done by orthodontics. So that's the the scenario that you can find. You have to really see the patient and determine what's the situation and try to solve it with the best treatment of choice. And ortho is going to be one of the of the treatment that can solve a lot of problems.
Okay. And in terms of ortho braces, I know there is like whatever the braces and then there are things now called clear braces, and then you mentioned something about Invisalign. Just tell us in a very short thing of whether one is the same and one or the other is the same, or whether there is a difference, and what those differences mean. Just very short and brief, please, Dr. Gomez.
It's a different aspect of orthodontics. We usually do orthodontics, regular orthodontics for cases that might need full treatment. Invisalign is done by patients that need minor movement. It's very, it's not a complicated case, and patients that don't need a lot of changes. It could be a case that can be done with Invisalign. It depends on the situation then, but we have different choices now that we can choose and pick for the patient.
Wonderful. All right. So basically, again, there are different technologies out, and not necessarily every one of them fits everybody. And that's why going to a dentist, I guess, is important. He or she will, lay it out. And I think that's why it's important to go to a particular doctor, dentist, who offers all the varieties. Because as they say, if you have a carpenter, he looks at everything as a nail. He wants to hammer everything down. And you have a mechanical metal machinery type of guy, he wants to weld everything down. So you need to go to somebody who offers all of it, and that's how you get the best fitting treatment.
Sometimes what we do in the kids, most of the time we do regular braces because they will not comply with the Invisalign. Invisalign, you really have to wear the braces 24 hours, and sometimes the kids, you cannot trust them. If they don't wear the aligner, you're not going to go anywhere. So in those situations, you want to have everything under control, and that's where you decide to go with the regular braces. For adults, people that have more responsibility, they will do everything that you tell them to do, and the Invisalign it's very choice for them.
Okay. Well, thanks a lot. Thanks a lot, Dr. Gomez.